Alright guys, so for this question we're going to be discussing the maxillary bone, and the maxillary bone is going to be from section A, and it's going to be question 18. Okay, now first off I just want to say that I'm going to be using a couple different atlases, and I'm going to be going back and forth quite a bit, only because the maxillary bone has so many different surfaces and so many different processes that sometimes it's hard to interpret the entire bone just from one picture. Okay, so first off we're going to discuss the fact that the maxillary bone is consists of the maxillary body, okay, and that takes up most of the maxillary bone, and this maxillary body is going to give off is going to be composed of 4 different surfaces. Okay, so the first surface you're going to have is your anterior surface. Okay, your second surface is going to be your nasal surface, okay, which is the area most proximal to the nasal cavity. But I personally consider it part of the anterior surface because, first of all, it makes more sense and it's easier to articulate. And the third surface is going to be your orbital surface, okay, right under the orbit. And your last surface, your fourth surface, is going to be your infratemporal surface, okay, which is going to be the infratemporal fossa. All right. Now, the maxilla is going to give off 4 different processes. Okay. The first process you're going to have is going to articulate with the frontal bone. Okay. This blue bone right here is going to be your frontal bone, and this thing right here is going to be your frontal process. Okay. Then you're going to have your zygomatic process. Okay, which is going to articulate with the zygomatic bone. Okay, and then you're going to have your alveolar process. Okay, your alveolar process of the maxilla is going to hold your upper teeth. Okay, and your last process, if you guys go to page 43 in your themes atlas, is going to be the Palatine process of the maxilla. Okay. Now that we've discussed the surfaces and the processes of the maxilla, we're going to discuss each of them in detail. Okay? So first off, we talk about the orbital surface. Okay? Now the orbital surface is going to form the orbital floor with the help of the orbital surface of the zygomatic bone. However, the orbital surface of the maxilla is going to form the majority of the orbital floor. Okay. Now the second diagram we're going to use in order to discuss the orbital surface in more detail is going to be from the themes atlas on page 41. Okay. So when discussing the orbital surface, it's important to mention the fact that you're going to have, if you guys can look at number 5, that's going to be known as your orbital sulcus, or your infraorbital sulcus, or your infraorbital groove. And this is going to begin right after the infraorbital fissure, and your infraorbital sulcus or groove is going to lead into the infraorbital canal. Okay. Now, if you look at your infraorbital canal, it's going to give off your anterior supraalveolar and your middle supraalveolar nerves, okay, and your anterior supraalveolar nerve is going to supply your incisors or your anterior teeth, and your middle supraalveolar is going to supply your premolar teeth, okay, which are right here, okay. Now, before the infraorbital neurovascular bundle goes through the infraorbital canal, the maxillary nerve is going to give off the posterior superior alveolar nerve, okay, through these mini foramina, okay, that you have here on this surface, okay, and this is going to be known as your infratemporal surface, okay. Now, as I was saying before, the maxillary nerve is going to give off the posterior supraalveolar nerves, which are going to go through the alveolar foramina, through the alveolar canals, which are going to lead to the molar teeth. Okay, So the posterior supraalveolar nerve is going to supply the molar teeth. Now, the anterior supraalveolar, the middle supraalveolar, and the posterior supraalveolar nerves are going to contribute and form the superior dental plexus. Okay? Now, let's discuss what surface this actually is. This is going to be your infratemporal surface. Okay? Now, we already talked about the fact that it has the posterior supraalveolar nerve going through the alveolar foramina, through the alveolar canals to reach the molar teeth. Okay? Now, this area specifically, number 16, the shaded area, is going to be known as your maxillary tuberosity. Okay? And the reason it's called your maxillary tuberosity is because it's a roughened surface which is actually the posterior wall of the maxillary sinus. Okay? Now, the maxillary sinus, okay, is actually going to be, it's going to have 4 borders, okay, but I think this is kind of an inaccurate illustration. So if you can look at the Netter's Atlas, the Netter's Atlas on, I think it was page 48. So let's go to page 48. Actually, page 49, sorry guys. So page 49 of the Netter's Atlas is going to show, I think, the maxillary sinus in a better illustration in order for what I'm about to explain right now. Now, as you can see, the maxillary sinus lies right above the upper teeth, okay? And it's really going to have 3 borders, okay? It looks kind of like a square, right? It's going to have 3 borders. It's going to have your frontal border, or your anterior border. It's going to have your superior border. And it's going to have your posterior border. Now, your posterior border, we've already discussed, is going to be the maxillary tuberosity. So that's going to be your posterior border. Your superior border is basically just going to be the floor of the orbit, okay? And the anterior border is going to be the anterior surface of the maxilla, or your nasal surface, okay? And in this area, you should have the maxillary hiatus, which is the opening, which is an opening of the maxillary sinus, okay? And that, guys, is going to conclude your infratemporal surface, okay? Now, it's important to know that your maxillary sinus is going to be more spacious in males than in females, okay? And if you guys want to know the fact that the maxillary sinus does open into the middle nasal meatus, okay? All right, now let's discuss the next surface, which is going to be your anterior surface of the maxilla. So let's go back to page 4 of the Netter's Atlas, okay? Now, the anterior surface of the maxilla, okay? First off, we're going to have your infraorbital foramen, which is going to be the exit of the infraorbital nerve. And if you guys remember from cranial nerves, the infraorbital nerve is going to innervate the side of the nose, the upper lip, and the lower eyelid, okay? Now, below the infraorbital nerve, okay, the infraorbital foramen, below the infraorbital foramen, and above the canine teeth, you should have a canine fossa, okay? And now, you can't see it in this picture, but let's look at page 41 in the Netter's Atlas. Page 49 of the Netter's Atlas. You're going to see a small fossa right above the canine teeth. That's going to be number 9, this shaded area right here. Now, this canine fossa is going to serve as the attachment for your mimetic muscle, known as the levator anguli oris, okay? Now, so that basically concludes your anterior surface, okay? Now let's just talk about its borders real quick. The anterior surface, okay, is going to terminate superiorly as your orbital floor, supramedially as your frontal process. It's going to terminate posteriorly or laterally as your zygomatic process. It's going to terminate inferiorly as the alveolar process, and medially is going to terminate as the nasal notches, and each nasal notch in turn is going to form the piriform aperture, okay, which is basically the entrance for the nasal cavity. Now, you see right here, right in the middle and inferior part of the piriform aperture, you're going to see a projection, okay? Now this projection is more clearly illustrated in page 41, okay? You see number 11, okay? That's going to be your spinous projection, which is known as the anterior nasal spine, okay? This is going to serve as attachment for the cartilaginous part of the nasal septum, all right? So that's your anterior surface and your pretty much your nasal surface covered. Now let's talk about each process, okay? So the first process we're going to talk about is going to be your frontal process, okay? So I think a good diagram to look at. So we're going to start off with looking at page 6. We're going to look at your frontal process, okay? Now your frontal process is going to have an anterior lacrimal crest, okay, which is going to be parallel to your posterior lacrimal crest. Now these two crests are going to serve as bony ridges for the entrance of the lacrimal canals, which are going to drain into the lacrimal sac, okay? So once again, anterior lacrimal crest is going to be on your frontal process, and it's going to serve as a bony ridge, and it's going to serve as the entrance for the lacrimal canal, which will go to the lacrimal sac, okay? Now let's look at page 41. Now the frontal process has two crests that are going to go into the nasal cavity, okay? Now the superior crest, as you can see number 27, that's going to be known as your ethmoidal crest. And your ethmoidal crest is going to serve as attachment for the middle nasal concha. And then you're going to have your inferior nasal crest, your inferior crest, and that's going to be known as your conchal crest. Okay, number 19 is going to be your conchal crest. And that's going to serve as attachment for your inferior nasal concha. So once again, you're going to have number 27, which is going to serve attachment for the middle nasal concha. And number 19 is going to serve for the attachment of the inferior nasal concha. Okay? And number 27 is going to be your ethmoidal crest, and number 19 is going to be your conchal crest. Okay? Now that pretty much concludes your frontal process. Okay, just know that in between these two crests, you're going to have your nasal surface of the maxilla. Okay? Now the second crest we're going to, the second process we're going to talk about is your zygomatic process. And all you have to know is that the anterior surface of the maxilla terminates posteriorly as the zygomatic process. Okay? So we've already covered two processes. Now we're going to cover alveolar process, which is going to be on page 43 of the Themes Atlas. Now the alveolar process, okay, is basically responsible for holding your upper teeth, okay? And it's going to form the dental arch, okay? Now, the alveolar process are going to consist of single dental alveoli, okay? And these dental alveoli can be defined as sockets for single-rooted and multi-rooted upper teeth, okay? So these are basically going to hold your upper teeth, okay? And in your alveolar process, you have to be familiar with two septums, okay? The first septum is going to be, now both of these septums are going to be in relation with the dental alveoli, okay? The first septum is actually going to divide the adjacent dental alveoli from each other, and that's going to be known as your interalveolar septi, okay? Now, if you can look at closely, just look, and if you can see number 12, okay? Now, the second septi is actually going to be within the dental alveoli, and that's going to be for multi-rooted teeth, okay? So this septum, which is going to divide a multi-rooted teeth within the dental alveoli, is going to be called interradicular septi. Okay, now once again, it's the interradicular septi is going to divide multi-rooted teeth within the dental alveoli, okay? So that is going to conclude your alveolar process. And the last process we're going to discuss right now is going to be the Palatine Process, okay? Now the Palatine Process is going to consist of, it's going to make up 3/4 of the hard palate. And as you know, the reason they call the hard palate hard is because it's going to consist of a skeletal framework, whereas the soft palate is not, okay? So once again, the Palatine Process of the maxilla consists of 3/4 of the hard palate, okay? And the Palatine Process of the maxilla is going to have a median palatine suture, which is going to terminate anteriorly into the incisive fossa. Now the incisive fossa is going to be passageway for the nasopalatine artery and nerve, okay? And anteriorly to the incisive fossa, you're going to have these two bones which are developed embryogenically, and later in life they're going to ossify to the maxilla. But these incisive bones, okay, they have a little division from the maxilla, and that division is called the incisive suture. Now this incisive suture is going to run in between the incisors and the canine, okay? So that's an integral part of your palatine process. Now let's look at number 7, okay? Number 7 is going to be known as your palatine sulcus, okay? Now your palatine sulcus is going to serve as a passageway for your greater palatine artery and nerve. Basically, your greater palatine neurovascular bundle is going to be passing through the palatine sulcus, okay? And as you guys know from beforehand, that the greater palatine neurovascular bundle should arise from the greater palatine foramen, okay? I think we've pretty much covered everything in the maxilla bone, and I'm pretty happy about that. So I just want you guys to remember the fact that looking at this bone from different pictures and try to watch some videos. I personally couldn't find any, but if you guys can find some, it's going to be good. And hopefully my video has done the job for you guys. But because the maxillary bone has so many different surfaces and so many different processes, the best way to visualize it in your head is just to keep looking at the maxilla bone from as many angles as you can and try to look at it. A lot of people say that you don't need to know the bone in that much detail, but I have to disagree, because if you really learn the bones well, you're going to have an easier time understanding everything that comes afterwards, because after all, in the body, everything plays a function, so nothing goes missing. So for example, say if you learned a small structure in the bones, it may not be relevant now, but when you learn the arteries and nerves, it's going to be relevant then, and it's going to help you understand them better, okay? So guys, it's going to cover question number 18, which is the maxilla bone, okay, from section A.